name's Candice. I'm going to be the chair for the evening, and I've been part of the group of women who have organised this event. Yeah, we've got, for those of you like tweeting, we have 2 hashtags. I should say that from the get-go. So we've got Women COVID Recovery or Women Surviving COVID. If you want to get tweeting, that would be amazing to just get some really good communication around the event. But yeah, I just wanted to say, so I live in Hounslow Borough. I'm also a local councillor in Hounslow. My ward is Hanworth, and I am the GLA candidate for the mayoral and assembly member elections, which are in May. A group of us, a group of Labour women, wanted to have this event really for 2 reasons. So partly as part of my campaign, we're really keen to just reach out and talk to as many women across the sort of constituency and really try and talk to not just Labour people. So we really are not going to be banging on about Labour tonight, but that's sort of part of the reason to really make sure that we're hearing from the voices of women across the Southwest and wider. You know, it's great to have people from Tennessee. That's amazing. And then the other reason is, you know, as women, we have recognised over, you know, lockdown 1, lockdown 2, lockdown 3, this year of the pandemic, we have noticed ourselves how hard it's been. I've found it, you know, the most sort of the biggest thing that's sort of put any kind of pressure on my own emotional health and well-being, that, you know, have found it really hard. And I know that women have found it particularly difficult. And we've shared our experiences as a small team, and then we've started to understand that there is clear evidence, which we're going to hear from our experts tonight about the evidence, that there has been some disproportionality. The pandemic has impacted women in certain areas more harshly. So we're going to hear about that tonight. So that's sort of the 2 reasons, was really to reach out and hear from women locally and also understand the issues. And we're really excited that we've got women who have joined us from so many different organizations. We've got women who are individuals, but you're all leaders in your own life, whether that's, you know, you play a leadership role just in your community, with your friends, as a parent, you might be leading in charity sector, you're leading in your profession. So you know, we all have influence in our communities around us. So it's amazing to get you together to share your experiences, but also we hope that we might be able to come up with some solutions from this evening. So if anyone comes up with ideas of how we can really look at how we heal and recover from the pandemic and how we support women who have been particularly impacted from the pandemic, then you know, then that's what this is all about, really, isn't it? We are the change makers. There's a saying that, you know, if you're not at the table, then you might be on the menu, and I see that as being part of politics. Like, even when we have got, you know, 50% of our MPs now in Parliament as women, there's still, you know, when you look at the pandemic, the ministers, the leaders who have been making the decisions have predominantly been men, and it means that they're not always looking at the pandemic through the lens of women. And also, as women, you know, when we don't just identify as women, we have many different identities and personalities. So tonight we are thinking, you know, we're women, but we're also women who are carers, we're women who are parents, we're women who've got disabilities, we're women from ethnic minority backgrounds, we're women of all different ages. So yeah, we really want to sort of really make sure that this is a really inclusive conversation as well. So without further ado, oh yeah, we hope to get lots of contributions from you all, and I would just ask that you all kind of really think about each other in your contributions, and we make sure that we are kind and considerate in the things that we say. And finally, this is a child-friendly event. I know lots of you will be juggling things this evening. We really don't mind if there's noise in the background. Like, I've been in meetings before and I'm just about to make a point and then, you know, it all kicks off. So we don't want that to limit anyone in any way. We don't mind a bit of background noise. So yeah, we really hope that we can have some great contributions for you all. So tonight, I've got two laptops for tonight. I'm going to introduce our first speaker, who I'm delighted is able to join us. We have Asha Herten. She's from LSE, and she is leading in this area. She's got a background in global health and human rights. She's a PhD student, but lecturing on this topic. And she's also part of a project called the Gender and COVID-19 Project. And she's going to tell us all about it, and it will really sort of set the scene for tonight's event. So take it away. Thank you, Asha.
Hi, everyone. Thanks so much, Candice and Sophie and Kezia and Grace for organising the event, for having me on. I'm going to talk a bit about the research that we're doing as part of the Gender and COVID Working Group. I'll be using some excerpts from interviews we've had, so if any of the issues that I mentioned resonate, feel free to use the reaction button or type in the chat, because I feel like I'm probably going to be sort of preaching to the converted, as this is the experiences of many of us. Yes. To get started, so I'm part of this academic research consortium, and we're looking at the gendered impacts of COVID across 9 different countries. That includes the UK, Canada, Hong Kong, China, Brazil, Nigeria, Kenya, and Bangladesh. And of course, all of these contexts are really different, but we know because of the patriarchal structures that we all live under, that infectious disease outbreaks impact men, women, and non-binary people differently. And because of this, we're funded by the Gates Foundation and the Canadian Institute for Health Research to undertake research and conduct time use surveys and policy analysis in every country that we're working in. And from that, we produce policy briefs, research publications, and attend events like this, where we try to share what we've learned with the general public, with government decision makers, and also learn more from the likes of you on this call. So I'm predominantly working in the UK context, so I look forward to sharing what we've learned over the last year, which is kind of insane to think about, that this has been the last year for all of us. So we've conducted and analysed about 100 interviews with 65 different women from across the UK, the majority of which were back in May, and then we did a second round at the end of October, just as we headed into the second national lockdown. And about half the interviewees agreed to be interviewed again. We've also been conducting an intersectional gender analysis of the government policies of the UK and the devolved administrations, as well as the decision-making of SAGE and the government's scientific advisory group. So I just touch briefly on our findings from the interviews, particularly around paid and unpaid labour, as well as women's perceptions on the government's response to COVID. Just a quick note to say that to find interviewees, we sent out requests via social media platforms through things like university Twitter accounts, Facebook groups for pregnant women and new mums, employment-specific groups for people working in healthcare, education, and other essential industries. Only one man responded, despite the fact that we made it clear that this was about all genders. So just a plea for all the men in your lives and non-binary individuals, that when we do say gender, we don't just mean women. But given who responded to our call and kindly gave up their time, what I'll talk about tonight is mostly the impacts of women, self-identified women between ages of 25 and 73. Not all the women were partnered, but the ones that were mostly partnered with men. Most of the women we spoke to were white, and most were based in England, which matters because the devolved administrations are responsible for health and education. So on to our findings finally. So on paid and unpaid labour, I think really what we saw was how interrelated the two are. And this is not obviously new to any of you on the call, but it seems that we're having to constantly challenge this false dichotomy between the two. So if I have to care for children or parents or sick friends, then I can't work. If I have to work many jobs and many shifts, then I can't care properly. If I can't work, I don't have the financial resources to adequately care. So support for people who care is essential, as are well-paid and decent jobs that allow us the time, space, and resources to care for our loved ones and ourselves. And since women predominate in both unpaid and paid care roles and insecure and low-paid work, the COVID pandemic has been particularly brutal for them. A world that supports women and care is not the reality that we are seeing in the UK this past year, despite the fact that the functioning of the state and society is dependent on that care work, both low paid and unpaid. So as one woman we interviewed said, women will just pick up the childcare. Women will pick up the care of elderly parents. They will shoulder the burden of whatever policies are put in place or decisions that are made. They will just get on with it. So most of the women interviewed particularly those with children, described having assumed more domestic care responsibilities during lockdown. For many, this meant that paid employment suffered because the additional childcare responsibilities and homeschooling while schools and nurseries were closed. The result of this was perceived poor performance in paid work, loss of income, and just exhaustion. The negative impacts on women's mental health was substantial in every interview. Every woman we spoke to referred to some sort of stress or tension. Some were expressly worried about the virus, some about job security, some felt guilty or concerned about the impact of the lockdown on their children. Most were concerned about the dual burden of paid and unpaid work during the lockdown. Many felt as if they had reached their bandwidth for being able to cope. In response, several women who were able to had requested furlough to avoid the balancing act between paid and unpaid responsibilities. And for women like these, furlough generally came as a relief. However, it did lead to some women questioning their identities, which had largely been built up through work. One woman on furlough had been calling herself a Stepford wife, and she was quite resentful of the situation. However, when we spoke to her again in early November, she looked back on the days of furlough as the golden days, because at least she didn't have to juggle parenting and paid work. In some interviews, we did see men had increased their domestic roles. Many cohabiting women reported their male partners engaging in more of the childcare. However, the distribution of that labour remained unequal. The women typically took on more of the additional load, as well as carrying the mental load for organising the family as a whole. Some women reported that the way that they engaged in childcare differed and was more time consuming than their husbands, highlighting an additional mental load experienced by women with children compared to their male partners. For instance, one woman told us, "My husband would be perfectly at ease with plugging them into a tablet or putting something on the projector. I sit there and go, ooh, I must follow a load of things on Instagram and find some sensory play and maybe some bloody chalk paints." So several women had also reported that their male partners had taken on more of the shopping, with one of the interviewees speaking of a return to almost gendered instincts. For example, I think we're possibly reverting a little bit to male dominance in making decisions and going out in that hunter-gatherer role. Despite this, despite the burden on women with schools being closed, businesses are not legally required to grant furlough for care purposes, and women are definitely at their wits' ends. So, moving on to how women perceive the government's policy response to COVID. Several interviewees noted the lack of women's representation in government decision-making and communications at the press briefings, and they attributed the lack of recognition of the gendered impacts of the government's COVID response to the fact that women weren't at the decision-making table. The concern amongst our interviewees was that this contributed to unconscious bias, whereby women's concerns were not considered in the development of COVID policies. Two said to us, "You've got somebody that's white, male, and middle-aged telling the nation what we should and shouldn't be doing." And I just don't think they think about women because they haven't got enough women in them. You know, they don't have that lived experience. So it's always just an afterthought, isn't it? For many, this lack of women's representation contrasted with the role women were playing on the front line of the response, highlighting the mismatch between the risks and additional work that these women were doing and their lack of meaningful recognition by the government. One woman asked, "Why are we not witnessing a conversation about men doing more rather than analysing the suffering of women?" Another said, "No one's asked Boris what his children are doing." While some women felt that the government had done their best in a difficult and ever-changing situation, several thought that there had been little change in the government's approach to considering and supporting women throughout the pandemic, despite increasing research and public awareness. And finally, perhaps most importantly, a number of women, particularly those living in the north of England, expressed frustration at the government's perceived neglect of the lowest socioeconomic and minority ethnic groups and the intersectional impacts of policy interventions. One woman said, "I think the glaring inequalities have been in class more than with women. And you can see that by the number of BAME people getting sick. And obviously there's other issues around BAME people getting COVID, but you know, there's a clear link between poverty and having to go to work and work in services that might be vulnerable to COVID. So no, I don't think women have been considered. And obviously women have been beep because of childcare. And if you can't afford childcare, then how can you go to work?" There was also a concern for the longer term impacts of this perceived gender blindness. As one woman told us, it is always bolted on. I honestly think that the damage this is going to do for women in the workplace is going to be really far reaching. It's going to go on for years. I think we'll have to claw it back. And so just a final point for me is that I think the thing to note in relation to the government and their responsibilities is that we have the 2010 Equality Act. The government is legally required to do an assessment on how every policy they make may negatively impact people with protected characteristics and therefore mitigate them. The government tells us that they've done these, but they've refused to publish them despite repeated requests from many sources. So you have to wonder if the government has done these assessments and carried on as they have, how accurate are they? And if somehow they are accurate, how on earth did they not have an impact on the government's response? Because look at what this has all meant for women. So I'll leave it at that. Thank you so much for bearing with my nerves, and I look forward to the continued discussion.
Thank you so much, Asha. That was so useful, and yeah, so many parts of that I'm sure would be striking a chord to everyone that's listening. You know, talking, I think that hunter-gatherer thing is so interesting. Like, yeah, we'll go and get the food, but you can do everything else. But yeah, so it's really, really fascinating. I had a Twitter message just before we came on from someone who was hoping to attend. She said, "Hi, I was hoping to attend this evening, but due to the bus strike, I've had to collect my husband from work after I finish work, and I've only just got home, need to feed the kids, hope it all goes well, would love to be involved in the future." And I was like, oh, you know, and I know that I'll make sure that we can sort of get her involved in some way, but yeah, it's, you know, it's really, really tough. I should have said at the beginning, you also talked about the women on the front line, but I've just got some little stats that may come up in other speakers, but I thought they're just, as you mentioned, it useful to share. 71% of our NHS staff are women, 75% of our teachers are women, and 80% of our carers are women, and also 95% of our unpaid carers are women. So yeah, just some sort of huge things to bear in mind as we continue this evening. So next up, I am going to introduce Maggie. I'm just going from one screen to the other. And Maggie is from, hang on, let me just get this right, Unison, London. Sorry, I don't want to get it wrong. So yeah, Unison, Greater London. So she's going to talk to us particularly around campaigning for equal pay and gender pay equality. Welcome, Maggie. You could probably do a much better job of introducing yourself. Please take it away.
Thank you very much. I don't know if I will. So good evening, everyone. It's really, really great, actually, that this type of event is being held, and I'm delighted to have been invited to speak. I am the Regional Secretary for Unison in London. For those of you that don't know, Unison is the trade union for public sector workers, and it's the largest trade union in the country, and we are the largest union in London as well. A matter of interest, I am the only female regional secretary of a large trade union in London. Yeah, just little old me. A little bit about me. I left school at 16. I worked in retail for a few years. I actually worked for Marks and Spencer's because that was considered to be a good job then. But I had a cleaning job in the morning before I undertook my full-time job, especially when I first had my first child, and I did a few Christmases working weekend nights in Sainsbury's when my children were small. I should state first and foremost, I'm a feminist. I was raised in a trade unionist and Labour family with very strong Labour women running the show. I've been a party member since I was 18, so over 30 years now. I've also been a member of the Regional Labour Board for nearly 10 years. I was the elected women's officer, and I now hold a trade union seat. The majority of people, as you've said, working in the public sector are women. So it's no surprise that women make up 80% of Unison's membership in London. And it's the complete reverse, actually, to most trade unions. It's normally the other way around. So I recognise, of course, that every single Londoner, regardless of gender, has been impacted in some way with the pandemic, but the impact on women has absolutely been the highest. So let me be clear, London would not have been able to get through this pandemic without women. We've played the largest role. and yet we seem to be paying the highest price, and that's physically, mentally and financially. So some of the examples we've picked up obviously from our members. We'll start with those who move to work from home. Trying to supervise homeschooling, I have to say every single one of you on this call that has had to do that deserves a bloody medal, because I'm not quite sure I would have been able to do that if my children were still young. You've been having to spin lots of plates whilst attempting to do a job, potentially from the kitchen table or from a bedroom or on the couch, anywhere where you can get a little bit of peace and quiet to undertake a job, especially if you've been doing these type of calls. In the press, and I'm assuming Jackie will talk about it as well, we've had a lot of impact. We've heard a lot of the impact on school children and teachers, with schools closing, opening, closing again, but not so much actually about the school support staff, the majority of whom are women. And for a lot of our members in London, we've got those school support staff are supervising key worker children who've been working in this, and they've been working in the schools since the very start. Obviously, teachers have been dealing with planning and delivering online learning throughout the lockdowns, but the school support staff are the ones that have been going in throughout. And if you take doctors out of the equation, the majority of NHS staff are women, the vast majority of NHS staff are women. And you'll have seen on the news, actually, when we first started this back in May and April, when nurses were moving out from home during the first COVID peak, so they can still attend shifts and not worry about bringing COVID home to their family. But the health support assistants, cleaning and catering staff in hospitals have been working throughout. They are mainly women, and the majority of cleaning and catering staff in London hospitals are actually black or migrant women who've been at higher risk. And we know that without them, the NHS simply wouldn't have been able to cope. And then we've touched briefly on care, unpaid care and paid care workers, but obviously I represent paid care workers, both those working in care homes, but also those providing home care. And again, the majority of workforce are women. As the COVID admissions rose in hospitals, we had more and more discharging of care patients to make space for the COVID patients, but they were discharged without them being tested. So COVID was spread throughout care homes, and we had absolute weeks of confusion. And I remember at the time thinking, this has only been a few weeks, but it felt like months because it just seemed to be relentless. All that confusion about the provision of personal protective equipment for care workers, and you'll all have remembered seeing it on the news. But actually that was a massive issue, obviously, because this was about people determining whether or not it was safe for them to go into work and do the jobs that they loved, or stay at home and try to stay safe, when they would have only got sick pay if they've had to isolate. But we had, and I remember one instance arguing with a care home employer that 1 mask per week for each member of staff wasn't sufficient, even if it was bloody washable. And that was the real confusion that was happening at the time. And then we had women that were having to make a choice between attending work because they were only going to get statutory sick pay if they were forced to isolate, or staying at home so that they didn't potentially spread COVID, or having to look after loved ones, that they had care and responsibilities at home, but literally having to survive on SSP. And we campaigned really hard, actually. The trade union movement campaigned very hard on that. And we got additional funding from the government that was given to councils specifically to ensure care homes were making sure that if staff had to self-isolate, they were getting adequate pay rather than just SSP. But let's not underestimate the psychological impact of dealing with patients or clients dying from COVID, dying alone with no family allowed, and then those staff having to counsel the family remotely, if you like. We've all seen the pictures on the news, obviously, with the iPads that were given to help with that. So Unison recently conducted a survey of women members, and we had about 50,000 responded. The results are stark, but they're not unsurprising. So I'm just going to give you a few headline figures. Half of those that responded earn less than 18,000 a year. and a third of those that responded earn less than £15,000 per year. So these are not high paid women working in the public sector, regardless of what the media would have you believe. Almost half have seen their spending increase. So specifically energy, because, you know, more people being at home, obviously with lockdown, food, again, having to feed more people at home, technology, transport and housing costs. And the reasons being having children off school a lot of the time, having a partner working from home or being furloughed. And some of the women have described being left to pay all the bills after the death of their partner from COVID, because we have to remember in London, it's over 16,000 people now that have died from COVID. And some, unfortunately, and this is, you know, really distressing, having to wrap themselves in blankets to save on paying electricity bills. The results of the survey also show a huge strain of those working during the COVID crisis, with nearly 2/3, 65% report not sleeping well, more than half report not taking regular breaks, and again, more than half say that they feel stressed most of the time. And specifically for these women, those that have children, that's an additional source of anxiety. So 3 in 5 are worried about the mental health of their children, and more than 2/5, so just under, it was about 45%, they're concerned about how the education is going to affect their children in the longer run. So throughout the pandemic, public sector employers have stepped up to the plate. I have to say they've been, you know, public sector employers have been really good. They followed the advice, the joint advice that have come from the trade unions and from government, and they've done the right thing by staff. So risk assessments have been done. There's been proper safe systems implemented for dealing with COVID. And within some of the NHS trusts, they've actually managed to source counselling services for those staff that have had to, you know, deal with the psychological impact of losing patients. But Unison's calling on the government to ensure all employers offer staff more flexibility over when they work, and not to take long hours for granted. We want them to fund childcare properly so it's affordable and accessible for key workers, and they have got to maintain the £20 increase in universal credit allowance, because that makes a significant difference for a lot of our low paid women members who rely on universal credit and definitely rely on the increase. We know that the public services will have come to a standstill without the vital jobs that are done by women across the country, but also, of course, in London. But they are exhausted. I think the last speaker talked about, you know, at wit's end. They are exhausted. They are worn out because of having to try and meet work demands. Those that have had to, you know, move to work from home had to do so very quickly without the right equipment. There was a lot of stress on trying to deliver. They're also trying to care for children. They have childcare responsibilities or caring for relatives, and were really scared about what was happening. And a significant number are dealing with debt. So we know that those on the low wages are the ones that are shouldering the biggest burden. But more importantly, if we talk about how we get, you know, what happens next, the country's economy recovery depends on women. It won't happen if women don't have money in their pocket to spend. But actually their mental and physical health is at stake. And I know there are significant concerns in a lot of the key worker roles where when we get out of this pandemic, they simply are just going to leave professions because they are just burnt out. So we're calling on the government to step up and provide the funding for these key services, give all public sector workers a pay rise, and make the support that they need to make their working lives easier mandatory from every single employer. I think that's about all I'm going to cover. I'm more than happy if people have got questions or suggestions or anything that they want to raise. But I just wanted to give you a flavour of what our, you know, significant number of members who are women are having to deal with and are still going to be dealing with in the coming months. Thank you.
Thank you so much, Maggie. That was really great, and really good that you were able to draw on certain groups within women as well who have particularly suffered and struggled. It's been really good to hear from our speakers so far. Up next, you'll tell from my introduction that And the people I get most excited about is young people, and I have a particular passion for young people. So as much as I can relate to a lot of the things that we talked about already and how the pandemic has impacted women with regards to employment and furlough and being a parent and thinking about schools, it was also not that surprising to realise that young women have also been impacted by the pandemic. So I'm delighted that we are able to be joined by Ashley Harmon from the Young Women's Trust, and also two real life actual young women. So we've got Loretta and we've got Freya, who are also joining us from the Young Women's Trust. And I should also take this opportunity to say hi to the young women that we've also got on the call tonight. I won't name them all individually and embarrass them, but I'm really delighted that they've been able to join us. So over to you, Ashley. I think you're starting, Ashley.
Yep, thank you. Is there any chance I can get the slides up to start off with?
Yes, I think, oh, brilliant. Look at that.
Thank you. So I'm Ashley, I'm from the Young Women's Trust. Thank you for such a wonderful introduction. So we're a feminist organisation and we work to achieve economic justice for young women. So we do that through several ways. We do research, we campaign, but also we offer services to young women. So we have coaching services which help young women realise their career goals and aspirations, and also we provide free, this is all free by the way, provide CV and job application feedback. So that's the main sort of everyday running of what we do. And bear with me while I have my Chris Whitty moment and say, next slide, please. Thanks. So in November, we published a report called Picking Up the Pieces, and this looked at young women's experiences during the pandemic. And since we have published that report, we've been working together with young women to develop a new campaign to really ensure that no young woman is left behind, and that's during the pandemic, and that's as we're planning our roadmap out of here. Can I have the next slide, please? So one of the elements that we focused on during the report was loss of income, and what the findings actually indicated was that an estimated 1.5 million, so that's 1 in 4 young women, have lost income since the start of the pandemic. So we found that 19% had lost working hours, 10% had lost their current job, 20% had lost future work, and 23% had been furloughed. Now, when we're talking about loss of income, it's obviously really important to look at what effect this is having on young women. So what we also found out was that 13% of young women had skipped meals to make ends meet. 30% of young women with a mental health condition had skipped meals to make ends meet. And 35% of young women's single parents had skipped meals to make ends meet. Can I have the next slide, please? So we also looked at young women's experiences of the benefit system, and what we found was that 1 in 8 young women had applied for benefits since the first lockdown. The rate was doubled to 1 in 4 for parents, and that's included single parents. And since March 2010, 69% of young women claiming benefits had done so for the first time. Can I have the slides back up, please? So what we can see from listening to Loretta is that benefits are a real lifeline at the moment. So what we're proposing is that, oh, it should be slide 5. Perfect, thank you. So what we're proposing and what we are going to campaign on is that the top up, so the uplift of £20 to universal credit is made permanent. And we will also be, in the next couple of weeks, releasing a campaign to extend it to carers allowance as well, because especially as we've heard from the previous speakers, women are taking on so much caring responsibility at the moment, especially during the pandemic. We also want to ensure that it's extended and kept permanent for those who are in education or training, who are currently receiving universal credit, to help them achieve their career goals. Can I have the next slide, please? Thank you. So, oh, just need to go back one, I think. Okay, so another element that we looked at was mental health, and some of the stats there were really quite shocking as well. So we found out that 57% of young women said that they worried about their mental health, and this was 51% in 2020. 36% of young women said their mental health had affected their ability to look for work, whereas 28% of men said the same. 24% of young women said their mental health had affected their ability to stay in a job. And a huge 41% of young women were worried about their employer not understanding their mental health needs. So now I'm going to hand over to Freya, who's going to share and talk through a little bit more on the findings in the report and her own experience.
Hi. So I'm gonna talk about mental health, which is it's a deep subject to me. I've suffered with it since I was like quite young. I think we first started realising when I was about 11. And ever since I've been like trying to get help. And I was a peer researcher when we did the Picking Up the Pieces report. So I was one of the people that like interviewed the young women that like featured in the report. And Asha's already like said the stats, but I'm just going to kind of like just say one more, which is in our Picking Up the Pieces report, we found over half of young women worry about their mental health. And to be honest, I can believe this because, like I said, I struggle with depression and anxiety myself. And I struggle with it so much. You could probably tell now. And it's something that like, it's hard to talk about because there's moments where you can get it all out. There's moments where you can't. There's moments where you feel like you don't know how to explain, so it's a lot harder. At the beginning of lockdown, it was really hard because I wasn't getting much support. I was on a waiting list, and that was 6 months worth of waiting before I finally got help. And when I finally got the help, I had one appointment which was face-to-face, which was why I'd waited the whole like 6 months I'd waited and before, because I needed more higher support. So I needed a psychiatrist rather than just someone a bit lower, so like a therapist. I needed someone that understood me. And lockdown really affected me because I felt like there was just so much buried that I couldn't get out. And because lockdown, you're always in the house, you can't do much, having to go on like one walk a day, you can barely see anyone. And it got the better of me. I ended up having to like have my medication changed. It just all kind of went a bit pear-shaped. But now I've managed to finally find like a ground with support, which I'm very fortunate about, because I know there's a lot of women out there that haven't got anyone and they need that support. But I struggled with it too. I know that sometimes you want to reach out for help, but it's there in your grasp, but you just can't. And it is so difficult because sometimes it doesn't, I don't know how to say it. It's sad because there's people that need it and don't get it. And I think that what the government should do as well, what the government should do is for people that need support but can't get it, through benefits like universal credit, they should be able to get like one-on-one support. Sorry, one-on-one support, where like if they could have like a certain like person that they can speak to, so even if they've not got like a therapist or a psychiatrist in place, they've got that person who they can talk to and know that they're not on their own. And I think that would benefit so many women, because there's just not enough out there. Sorry if I ramble on.
That was brilliant. Thank you so much for sharing and being so vulnerable, Freya. Yeah, so just to reiterate what Freya said, so one of the things that we're pushing for is to ensure that all claimants can receive one-to-one mental health support. And also we want to make it easier for work coaches to build positive relationships with claimants. So we're really going to push for stopping sanctions as well. So I will leave it there, but again, thank you so much for having us. I will drop the link to the report in the chat if anyone's interested, and just keep your eyes peeled because we will be launching our campaign sort of next weekish.
Thank you so much, Ashley. The slides were brilliant, and I'm sure we'll be able to share them widely and with everyone who's attended. Also, massive thank you to Loretta and to Freya. You know, it takes guts to speak on these calls, but to share sort of personally, especially when you're going through things that aren't always, you know, something from the past, something that can be still very much in the present. You know, that we really appreciate just having being able to get a greater understanding. It's so important that we talk about mental health when we're talking about COVID recovery, and it's great that we can also talk about it when we're considering gender as well in the COVID recovery. We are a little bit pressed for time, so, and I'm really keen to get like lots of voices when we open up the discussion. So I'm going to introduce our final speaker, who is the wonderful Jackie Schneider, and she wears a lot of different hats, but she's here tonight talking about her role as a primary school teacher. She might want to also share some of the other things that she does, but yeah, please welcome Jackie.
Well, how do I follow that? Really, Candice, you've given me such a hard job. Fantastic speakers, and it's such a privilege. I won't repeat what they've said, but honestly, it was really, really impressive. I'm just going to start with sort of the theme that Asha started with, that idea that we're all in this together, that this pandemic has suddenly arrived and we're all in it together. And actually, we might all be in the same storm, but we are absolutely not in the same boat. There are those who are on ocean liners who barely notice a ripple. There are those on purpose-built boats. And actually, for the vast majority, and the people who are the key workers, and for women, they're clutching to bits of life raft, of bits of, you know, timber that's bobbing about. And you know what? The government want us almost arguing and fighting over the bits that we are struggling to survive with. And I think that that model is completely wrong, because for most of us, and certainly for women, this pandemic has been absolutely catastrophic. It has not been catastrophic for the billionaires. It has not been catastrophic for people who have made billions. Now, I don't begrudge entrepreneurs, I don't begrudge them their money, but when mankind is facing crisis, it is only reasonable that human beings who are kind of hardwired to support and help each other, that actually we use those resources to support each other. It is not unreasonable. And I'm so proud of the trade unions who have really said this loudly and clearly. And Maggie is absolutely right. The media want us all arguing about each other, and they insist on talking about teachers, and actually no school in the land could open with just teachers. It is the site managers, the cleaners, the cooks, the support staff, the office staff. It's an entire team of people, and it's really important to kind of to remember that. Yeah, I think it's really important that a lot of the issues that we've talked about, the problems with mental health, the problems of poverty. We're living in Britain, one of the richest countries in the world, and parents don't eat because if they do, they can't feed their children. I mean, we should be incandescent with rage at that. The sort of pressures being put on women, so they are literally having to choose between breaking the law, risking public health, or keeping a roof over their head, or not leaving their child unattended. These are immoral choices no one should have to make. And so we have to find ways to work together so we can challenge some of these appalling decisions. And I will just talk about schools, because again, I think that the media love nothing better than setting one group of worker up against another. And actually, we have to go beyond that. We have to discuss the real issues, not the way the media want to frame it. Or when I forgot to say solidarity to the bus workers as well. You know what? Women like me that don't drive rely on bus workers. Women who are low paid rely on buses. And I know that bus drivers actually have had a terrible rate of mortality. More bus drivers have died during that pandemic than teachers actually. And that's never acknowledged in the mainstream media. So solidarity to bus drivers. So I will just quickly talk about the teachers and schools being open. It is really complex. We are in a pandemic that we've not seen the like of before, and we have to balance the pressures of keeping schools open, allowing parents to function, and also children's mental health and well-being, and also the pressures of keeping the rate of infection down. And also, as a trade unionist, I make no apology for wanting a workplace that is safe for the cleaners, the teachers and support staff. And I won't apologise for that, and not at the cost of the children, but we need to keep our schools safe. And certainly my union has never wanted to shut schools. Our underlying position is always, we want to keep schools open. We can only do that when they are safe. And actually what we were forced into saw schools open in name, but in practice, I know families who had to self-isolate time after time as bubbles went down, and start, stop. So their method of keeping schools over was absolutely appalling. And working with, and it wasn't just one trade union, there are 9 trade unions who normally, if I'm frank with you, sometimes can't even be in the same room, who are arguing and squabbling with each other, but came together. And not just trade unions, the head of the school leaders, the National Association of Head Teachers, governors' bodies, actually have all come together because they know that we want to keep schools open, and this government is refusing to even meet with us, to even begin to discuss how we can do that. And I would just say there are 4 themes really. There are obviously the trade union issue of wanting safe workplaces and safe places for kids. We also want to support low paid workers who we know rely on schools for childcare, and we can't put those people in that position. But we also need to support the disabled and people who are vulnerable. I've had families who one member is going through chemo and the risk of sending the child back, and they're being put in a binary. Either you send your child back to school or your child loses your place. Well, actually, I think there's a position in between that. We should provide online learning for those children who cannot come in, and we have also got vulnerable staff who are recovering from breast cancer or whatever, who actually could be at home to give that sort of remote learning. So I think it's complex. There are lots of solutions, but what we mustn't do is fight amongst each other. I think we have to find ways to listen to parents. And I apologise to every parent out there who's been sent some crazy project or some madcap scheme. You've had to pick up the pieces of home learning. I can promise you that my union, we went through all the plans with the tooth comb. We asked for nothing that parents would have to go out and buy, and we built the work around parents who were also looking after a number of kids. So I would say it's solidarity to everybody out there. We have to work together. There are no easy answers. I am supporting my union, but we have to work together to ensure that we all survive this. And I'd be more than interested to take any questions about the schools and positioning. But as I say, we have to work together. We have to do it safely. And yeah, the unintended consequence of opening schools is sometimes it sends out the message. It needs to have also the message that we can keep the schools open, but other things have to stay closed. And that doesn't mean because your child's now at school, you can then still go out to work. So it is complex. And there are a million one solutions. We could have invested in proper ventilation. We could have bought plexiglass. And I just say to people, look at what's happening in Eton. I was on the Eton website the other night. Look at what the private schools are doing. That is what our children deserve. And just to finish on mental health, we have to stop seeing education as the way out of poverty. It isn't. Money is the way out of poverty. Increasing universal credit, paying the right wage for a job. Nobody should be in work and in poverty. Education won't end that. And one of the biggest drivers of mental health problems is seeing education as like the Hunger Games. We're rationing a decent living to only the worthy few who come at the top of the pile. Education isn't a race. It's not a competitive sport. It's about living your best life. It should be separate from poverty. And I want to ban the words catch up. No child needs to catch up. This has affected the entire planet. We are not in a race. So we're not going to use it to get a competitive advantage because Yorkshire schools are out, so we can go in higher. So let's ban catch up. Let's treat children's well-being and put that at the heart of the curriculum. And that's my 10 minutes. So thank you for giving me the chance to rant.
Thank you so much, Jackie. Well, you were last, but you definitely weren't least. And look at that, to time as well. It's a really, really amazing and such brilliant contributions. I really hope that we can take this collective rage and do something about it together and, you know, put all our passion and energy into coming up with solutions and recovery and healing. And I completely agree with you on the catching up issue. So at this point in the Oh, my mum really likes you, Jackie. So at this point, we want to open up the conversation. We've got half an hour, so if we can try and keep to like about 2 minutes. But basically, if you have a question, if you want to make a comment, or if you've got a solution, then now is the time to put up your hands. We have had a few people that have already indicated that they'd like to speak. So I definitely would like to bring in Harleen Atwell here, who is one of the Hounslow councillors, has got a very useful, interesting perspective. Also Tanya from Grow Baby. We've got Grace Bollins, who is a local young woman and parent. And we've also got, and Karen, who is from Our Barn. So if those people are sort of ready to get in the queue, I can see Heather waving. I'm going to write you down, Heather. So yeah, we've got various people looking out for hands up and questions, but please welcome Harleen Atwell here. So just 2 minutes, please, and then we can get as many people in the discussion as possible.
Hi, everybody. Good evening. Sorry, I've just stuffed my face with a bit of chocolate. My husband gave me the chocolate, by the way. My name's Harleen. I'm a councillor alongside Candice at Hounslow Council. I'm 45 years old. I have MS, multiple sclerosis. I've had it for 10 years. Before the pandemic, I was okay. I was like in and out of the house, picking my son up from school, attending council meetings. But since the pandemic, I feel like everything's gone a bit downhill in terms of my mobility as well. You know, being stuck indoors, you know, it's just been a bit tough. And now Boris has just announced that the secondary school kids are going back to school on the 8th of March. So I'm even more nervous because, you know, if my son goes to school and by chance, if he gets anything and then brings it home, you know, there's a chance that, you know, I'll contract it as well. So even though they're saying they're going to be tested twice a week and all this stuff, I'm just really nervous. And, but, you know, like, I just hope everything dies down soon, then we can get back to normality and get in and out more, because, you know, I only went out a day before yesterday. I managed to get out the front door and get into the car after like 4 weeks of sitting at home. And some days it's like, you know, I think for getting out of bed, was there any point in getting out of bed or getting dressed and coming down? So it's just, it's been really tough. It's been really hard, especially having a disability. You know, I can only walk with a mobility walker. And when I'm outside, it's a wheelchair or a mobility scooter. Before the lockdown, I had everything in place. I was, you know, going to an amazing MS centre in Wendover like twice a week, and the MS nurse was regularly in contact. But now it's like, you know, am I going to get my medications? And am I going to get slots for online delivery in time? And, you know, whereas if, you know, we were only sort of having the evening meal together as a family, it's now we're having to feed him like 3 times a day. So it's a lot of strain. It's a lot of strain. Thank you.
Thank you so much for sharing that. It's really important that we keep all these different lenses at the front of our sort of at the front of our brain, is basically what I'm trying to say. Thank you. Okay, is Tanya happy to come in?
Yep, here I am.
Hi, Tanya.
Hi. So I help run an organisation called Grow Baby, and we provide new and used baby equipment for families across Kingston and Richmond. And before the pandemic, we were running many groups that were supporting young mums. We also work with the antenatal team, running the antenatal care for young parents and vulnerable parents, English as a foreign language, and parenting classes for parents who have children with additional needs. So in the pandemic, we obviously had to change the way we work because we couldn't see people face to face anymore. And so we started doing mostly deliveries to families, because what we were finding was, well, first of all, we got some grants, which was really good, to be able to buy nappies, formula, baby food for those families that needed it. And then also grants to be able to work with the Fresh Fruit Co-op, providing fresh fruit and vegetable boxes to families that needed it, as well as some crisis grants. And what we found was that the type of families that were coming to us changed. We've got families that generally there were mostly families who had never navigated the universal credit system before. They didn't know what was going on, or people who have no recourse to public funds, women especially who were doing sort of little part-time jobs here and there that just couldn't do that anymore in order to you know, supplement incomes. So we've been doing that through lockdown 1 and through this lockdown. And we, for our baby clothes and equipment, that's all free of charge. And we don't require referrals, because we like people to come to us and not have to explain again why they need something. They can just come to us and say, we need something. And if we've got it in our basement, they can have it. And hopefully when we open up again, we can invite we have lots of mums that come from refuges that have arrived in Kingston or Richmond. They don't know anybody, they're all alone, or asylum seekers. So we try and create a space where they can have coffee with us, tea, give them lunch, create a sense of community. So yeah, that's us, that's Grow Baby. So if you've got any families that need help, send them over to us.
Thank you, Tanya, and thank you for the work that you're doing. Yes, it's really important to also mention about sort of increased isolation for people having babies for the first time, or not necessarily the first time, but yeah, it's already can be a really isolating time. Your life changes, the world turns upside down. But I know that I found it just really useful to be able to be around other people who are going through the same thing. But to go through that without being able to meet up and just, you know, just have someone say it's okay, yeah, that happened to me too, is, you know, it's really difficult, as well as all the women who've had to give birth alone or only have the birth partners at a certain stage and not have partners in scans, especially if the scans are, you know, not the outcome that they're hoping for, etc. So thanks for drawing attention to those issues, and we'll make sure that we share the information about Grow Baby. Thank you. So next we're going to go to Grace Bollins.
Hi, I'm going to quickly talk about maybe a bit of a taboo subject, and that's young mothers and how they've been severely affected by the pandemic. So I felt that the cuts that the Tories have made to public services were so present during the first lockdown. From experience, I was living in a mother and baby unit. I've actually met Tanya from Grow Baby before. I was living in a mother and baby unit, and from the start of the lockdown, actually from January 2020 to when I moved out in this January, we never once saw support workers and were contacted twice by support workers. In the unit, there was drug use, physical abuse. This actually ended up in someone being stabbed, almost killed on New Year's Eve of this year. And I felt like the support that we received was next to nothing. And this is because of cuts, and it's only getting worse. The unit has since been decommissioned and is no longer a mother and baby support unit. And this is happening across the country. And I feel like us as women should work together to ensure that these units aren't closed down and that young mothers receive the support that they need to help raise their children, to help get out of poverty, to be given opportunities for education, for work. The women I lived with often were in really dire situations. Like, I was fortunate, I have a very supportive family. I was furloughed from my job and I'm also at university. So I was lucky to have a lot of support around me, but the women who lived there often didn't, and were sort of left behind by the system and couldn't, like, literally would have to choose between buying nappies and putting gas and electricity on their cars. And in modern Britain, that shouldn't be a thing. This is happening in the borough, this is happening across London, and it's happening across the country. And us as women should protect the most vulnerable in the country, and that obviously includes young mothers and, of course, their little darlings, just like my little darling. So, yeah.
Thank you so much, Grace. Thank you for sharing your experience. And I know, Grace, and I know that you're a brilliant community activist and campaigner. So, you know, not only have you had this experience you can share with us tonight, I know that you are pushing for change to make sure that things are better for future young mothers. We're going to come next to Karen, but Ruth Cadbury has popped up onto my big screen. Are you happy to come in after Karen, Ruth? Great, thank you. Okay, so we've got Karen from Our Barn, please.
Hello, very interesting discussion to listen to all. So I'm here from a small charity that's based in Isleworth, and we predominantly support young people with learning disabilities or autism at the time when they leave formal education and start forward into their adult life. As an add-on, something that we've done for a long time, we've actually brought a carers project into our charity, because what we were finding is that you're having conversations with people at the gate as they drop their young people off, and they needed some significant sort of support really to navigate the system, basically. So we do have quite a successful, if that's the word, in demand, I think the word is, carers project that is led by me, and we have about 3 or 4 other volunteers who have lived experience of being a carer. So the stat about 95% of unpaid family carers being women, yep, that's exactly what we see in our project. Long-term caring responsibilities going on for decades. Start caring for a disabled child, and at some point also end up caring for a very elderly family member, and you know, for a lot not able to continue in the workplace for quite substantial period of time, really. Impact of the pandemic has been really that packages of care that allow you a break from caring have disappeared, really. The first pandemic, we lost access to our venues, to all our buildings, so we weren't able to do any face-to-face support for young people, which, you know, at the same time gives their carer a break. Second, are we in second or third? I don't know. This time around, we have been able to continue face-to-face for 2 days a week, which gives, and we're doing a lot of Zoom as well, which gives everyone some kind of break. And we're still, I was very not delighted at Jo Wiley, but she spoke very well at the weekend about the situation for people with learning disabilities and how difficult it is and how powerless the families are in securing the support that they need. So that's really, she has summed it up so well that I don't think I need to say any more. But so if you haven't had a chance to go and hear what Jo Wiley has to say, she was interviewed by Andrew Marr yesterday, and she did a great job of advocating for families. So that's what we do, and yeah, I don't know. I still struggle to see a way for us to get out of this pandemic, really. But anyway.
Thank you, Karen, and thank you for all the amazing work you do. And you know, I know that I've been really grateful to meet you and meet with some of the carers, and I definitely continue to keep pushing and making sure that you're not forgotten group. I know that you feel particularly neglected, but yeah, it's really important that we keep hearing your voices. I'm going to bring in Ruth Cadbury, who is the MP from Isleworth, but I haven't forgotten Heather. So after Ruth, it's going to be Heather, and then I'm going to look to Sophie and Kezia to tell me who else would like to come in.
Okay, I'm obviously not one of the main speakers because you didn't come to listen to me, but I just wanted to thank the speakers so far, and particularly the bravery of Loretta and Freya and Grace as young women whose voices aren't often heard in so many events, political events, and you know, with a capital P or a small p. And thank you for your testimony. And as I put on the post, it's really helpful to us as MPs and politicians, as councillors. It doesn't have to be on the record. We can use other names or just, you know, what we've been told, but it really pushes the point home. And I mean, let's just go, you know, in terms of inequality, somebody said something like the only thing the Labour government did well is Sure Start. Well, that's gone. But remember, the Labour government did a lot more. The working families tax credit, the national minimum wage, and you know, so much else. And so much has been going backwards over the last 10 years, even before COVID, in terms of the gender pay gap, and the government has quietly dropped the requirement of companies to report on the gender pay gap. The value of benefits has gone backwards, and you know, even if we can retain, which we're fighting for at the moment, retain the £20, stop the government's taking £20 off universal credit. Universal credit, as has already been illustrated tonight, is not enough to live on. And the growth of food banks and the queues outside food banks, that says it all about what the Tories were doing anyway, and how they've tripled even in the last year. And that's just unbelievably shocking in the UK in the 21st century. There's other issues in terms of COVID, because women are often looking after children while also being on work Zoom meetings, and women have lost their jobs, or their promotion is delayed, or the stress of the implications of that for people. And you know, it's not something, you know, my kids are grown up, and actually one of them's living here and cooking for me, so you know, I'm very lucky, and I know that. But you know, having been in meetings with women who are also doing childcare, I don't think I've been in a single meeting yet with a man who's looking after a small child. But so and you know, this is in the context of Labour Party and so on, and we're all relaxed and often sisters anyway. But I can only imagine how stressful that situation is when you're in a hierarchical, male-dominated job, and how it must feel for you, and what it actually means to your retention of your job, your promotion, and so on, or your, you know, or whatever. Being able to work flexibly, which again is another thing that we're going backwards on. So you know, there have been huge coronavirus impact on women disproportionately, and then you get the intersectionality on top of that, the impact on BAME women, the impact on disabled women, and the impact on women learning disabilities, and of course low paid women in front-facing jobs such as caring and so on. So we do keep raising these points in Parliament, and Marsha de Cordova is very strong on these issues. I have to say there's some cross-party work as well, and the Select Committee on Women and Equalities has done a series of reports on inequality and COVID, and one in particular on gender. So I can put up some of those details as well. But you know, please, and particularly my constituents, do write to me, or anyway write to me if you've got something that we can pick up as MPs, as Labour women MPs, and also that we can put up in terms of supporting Candice in her campaign to win South West London in the London elections, which will be amazing because it's traditionally been a Tory-held seat, and you know, I'll be backing Candice's campaign. And somebody did say, how can I help? Well, one thing you can do if you're a Labour Party member is to sign up to Dialogue and go to one of the training sessions that Sophie organises, or Connor in Brentford and Isleworth organise. And it's very simple. It's quite a simple, straightforward online phone system with a script. You don't have to know Labour Party policies or anything like that. And it's a really good way that you can help, because we can't go leafleting and we can't go door knocking. So you know, that's really useful. So thank you very much. I'll put my email up in if anybody wants to get in touch. Thank you.
Thank you, Rue. Thank you so much. I know that Chantel is here representing an organisation that works with women. I don't know whether you're happy to share anything, putting you on the spot.
Hi, yes, I was just about to say, actually, if I could, it's a bit nerve-wracking, but hey. So my name's Chantel, and I work with a bunch of lovely ladies from Ballina Grow. We help women with getting back into employment and training, and also building up their confidence and motivation, because we all know what it feels like to be out of work for a really long time. It could be really nerve-wracking getting back into it. I know that personally. I have 2 children and one who's autistic. So I'm also a carer as well as working from home at the moment. So I feel like I can relate to a lot of situations with my customers that I work with. We have a coffee morning every Friday, which is a really good turnout. We have about 40 plus people coming, and we always have a speaker that comes along. So it'll be someone from a college or someone from ESOL that will come along and just, you know, give information out to help our women. So yeah, that's about it really, but I can leave all information down in the bottom in their message feeds. So I hope that's helpful. And this event is really great, Candice. It's really been good.
Thank you so much. Thanks for sharing. That's really great to have your contribution. I was going to share while we're looking, someone else who wasn't able to attend tonight, but something that hasn't come up, surprisingly actually, is also the increase in women seeking support around domestic abuse. And we've seen reporting rates go up. So that's another area where women have been disproportionately impacted. You know, as much as there's been lots of communication and messaging about women being able to leave the home for reasons of safety, we've still seen increases. We've still seen murders occurring over the past year, women who are in domestic abuse relationships. But I had an email from a young woman who works for the Women and Girls Network, and they work specifically with girls who've experienced violence and sexual violence. So yeah, I'm just going to share a little bit what she has said. She said, this sounds like a really great and powerful thing to do, to have these conversations, but she wasn't able to join. There are so many added elements that will make it harder to leave abusive relationships, family than usual, and being on lockdown makes it significantly more difficult to engage with them too, as it is very hard to just find a safe space to chat. I know just from my caseload, I have 9 young women. There's been less engagement than last year at the beginning of the pandemic through to summer and autumn. I had quite high engagement as they were still at school, and I was able to see them face to face and still work to create meaningful relationships with them, which is so important. Some of my newer cases I couldn't meet face to face due to the lockdown. When I have engaged more recently, they've been going through a lot. Some of the themes are domestic violence in relationships, family breakdowns and fights resulting in homelessness, also breakdowns in trust with parents and young people. In some cases, this results in parents being more strict as they're worried about what their children are getting up to. And then she also highlights something really important: increased technology has facilitated abuse, so sending indecent images and experiences of online grooming and sexual exploitation has also been, another risk area, and general online abuse on social media. She's also experienced young women experiencing showing self-harm behaviours and suicidal ideation, and sort of dropping out of education altogether as well. And another thing that she talked about was issues related to sleep and people struggling to sleep, and how that impacts on their health and well-being, and also issues around maintaining a healthy diet. So, I mean, she just put all this information in this email, and I really was hoping that she might be able to come and share tonight, but she wasn't able to. But yeah, I just think it's so important that we are just remembering. I mean, it's so huge, women, we are like half of the population, and we've experienced a pandemic in so many different ways, but our voices haven't been strong enough. We've seen things on the news, and as Asha talked at the beginning of the conversation, she works with Claire Wenham, who is a voice that probably you've seen on the BBC News, although she kind of became more famous on the news when her child interrupted, one of those classic children interrupting during the news item, and suddenly people were a lot more interested. But so yeah, it's really important that we keep sharing these stories. Yeah, let's hear from Marcella, if you can keep it short and sweet, and then we'll just have some final thoughts from our panelists.
Yeah, I've been working in the women's sector for the last 13 years. So I work for generic organizations, for migrants organizations. And what I see in the last pandemic, apart of all the things that you're saying, Candice, that are all true, is that first, we have to remember that in 2013, the World Health Organization said that domestic abuse was a pandemic. That was said already back then, and you can see the response to that. Nothing happened because, of course, it only affects women. And we know that the women's issues are not always there to be receive a response. So now that the pandemic affects all of us, we are responding. But taking that in consideration, I will say that, for example, for migrant women, for women with extra barriers, women who don't have access to public funds, women who have an insecure immigration status, this is even more difficult because many of those women are key workers as well. For example, women from my community, from the Latin American community, they are women that are cleaners. They are the cleaners of the hospitals. They are the cleaners of the care home. And what happened with them is that they couldn't pay attention to the domestic abuse because they were terrified to lose their immigration status and their jobs. So they have to keep working without even paying attention if they have the PPE equipment, if they have what they needed. And we, at the beginning of the pandemic, we started receiving less calls because they were so worried about keeping their jobs and not being out of work that they didn't pay attention to the domestic abuse. They couldn't. And then at the end of the pandemic, at the end of the first lockdown, we start to have those conversations as well. We also had a project on sexual harassment in the workplace, and the women didn't want to talk about that. They wanted to talk about how I keep my work. So we are talking about those intersectionalities that we have immigration, we have low pay, we also have domestic abuse, we have sexual harassment in the workplace. So we think to pay attention to this holistic figure of these women. We as an organization, we push for the domestic abuse bill that has been discussed in Parliament to take in consideration the situation of migrant women. That didn't happen. They are not taking in consideration the situation of the migrant women. Migrant women are having to decide without even be deported or call the police, because we know that the police is sharing information with the Home Office. So migrant women are not calling to the police. They are not calling to the police to tell them about the domestic abuse. They are not calling to the police to tell them about the sexual exploitation. They are not calling to the police to tell them about the labor exploitation. So we all have this situation going on in the in the middle of the pandemic because they are still working. So that is something to bring into this conversation as well. I think we all have a shared responsibility in the sense that we have to keep talking about this. I'm not going anymore because
I'm so glad you said it so well. I invited Southall Black Sisters to attend, but I don't know if they've been able to. But yeah, if anyone needs support, they do specifically support women who have got like no recourse to public funds and things like that. So please check out Southall Black Sisters. But thank you so much. So yeah, if everyone on the panel is happy to just give 1 minute or even just any last brief comments, that'd be wonderful. So is it okay to go to Asha first?
Hard to follow, but I think intersectionality is just key, and the breadth of issues and the breadth of problems is just astounding. And when you work in this area every day, it's unfathomable that people in the government don't get this. So I just want to say thank you to everyone that's working on this. Certainly in my presentation, I wasn't able to cover the breadth of issues, but also in the way we do research, we're not able to cover the people that just don't have time to talk to us. And I think that there are lots of people on this call who are working directly with people like that. So I'm really grateful, and I'm grateful I got to learn from you all tonight, and I will be following up on your work. So thank you.
Thank you so much for giving your time and staying to the end. I was like, oh, I should have just checked even if you're still here. So I really appreciate that. So again, to Maggie, if Maggie's been able to stay to the end, any final comments?
I'm here. So just a couple of minutes. I mean, I think it's been really, really useful and interesting to listen to everyone's contributions, but also what's been in the chat. And I think actually it's really good to hear from a group of women that actually recognise the issues and want to do something about it. I think it's really important. I mean, Jackie talked about communities helping each other, and actually it's a very long time since my childhood where we had that community kind of organising where people did look after each other. And I genuinely do think that that with the right leadership we will be able to get out of this situation, and hopefully we'll be in a much better position. Women will be in stronger positions, but it's not going to happen if we don't have the right government and we don't have the right politicians leading us, because the ideology gets in the way of the practicality and the pragmatism which women are so used to having to deal with. So I think this is a really, really good first step, and I'd be really interested to be involved going forward.
Thank you so much. Thank you for giving your time. Do we still have Ashley?
Yes, I'm still here. Just to echo what everyone said, I mean, wow, what an amazing room. I'm going to use the word room to be in, and it feels really heartening to be in a room with so many passionate people that are pushing for change. And all I would say is that let's keep putting lived experience at the heart of what we're doing, and not speaking for those people, but making space for them to be heard because they're already shouting.
Thank you. Freya, is Freya still here?
Hi, I'm still here. I just want to say thank you so much for letting me speak. It's like been an absolute honour. And like, thank you for the comments saying that I'm brave, and that like, just thank you. Like, I believe that if I use my experiences to speak, then it can be used, and then it's like a real story. So then like that impacts more. So I'm always happy to like share. So thank you again for having me.
Thank you so much, Freya. And if you know Loretta, please thank Loretta for us as well. And last but not least, Jackie, any final thoughts?
Yeah, actually, what I'd like to say is about what do we do going forward, because the world is changing. Jobs that we thought were secure aren't. And I want to link with what Bree said in the chat. We shouldn't ever waste any opportunity to look at how we can use it to shape the sort of climate emergency. And what I know is going forward, we've got people in jobs you know, some of the events industry. I mean, some things will come back, but not everything will. And so we've got people, possibly the airline industry, that maybe, you know, it will change for a long time going forward. And then we've got real needs like changing our community spaces, like building more open spaces, like growing food, like mental health projects. And we've got people who haven't got jobs. And so an intelligent government needs to plan forward and link how we can move people from one area that is no longer economically going to be sustainable, but actually to do something that's a really good social use, and is much cheaper to make real projects. And in that same way, after the Second World War, when this country was on its knees, absolutely broke, poorer than we are now, we still built homes for heroes, we still built the NHS, and we need that sort of vision. And that will not happen by a few billionaires and a few ministers getting together. There's got to be a drive, and there's got to be pressure. So people like Maggie's members, people like us, community groups, wherever you are, whichever groups, the greenish areas, we have to work together to forge a future that is sustainable for this climate. And we shouldn't let any opportunity to go by without actually saying, how can we use this to end the climate emergency? But thank you so much, and brilliant women. And I think we have to find ways to connect, and it was so brilliant to have such a great panel and to get so many people to speak without grandstanding. So it was a great meeting, and I thought it was really successful. So thank you.
Thank you so much, Jackie. Yeah, we really want to look forward. So we hope to put together some just simple notes that we can share with everyone. Any ideas that have come up. I know people have been looking in the chat, and I think you can save the chat. I'm not very techie, but yeah, so we're really grateful for all the comments that have gone in the chat, for people who've contributed verbally, for those of you who stayed to the end of the call and given up your precious time. You know, as women, we don't have spare time. When people talk about spare time, we don't really know what they mean. But yeah, so thank you for giving your not spare time tonight. I completely agree that any recovery for women has to be intrinsically linked to green recovery, and any green recovery has to be intrinsically linked to economic recovery and health recovery. You know, it's really, I was in a meeting just earlier this evening that we were talking about, you know, how important it is that departments have to stop working in silo, and we have to start thinking about people and putting people first. So yeah, I'm so happy that you were all able to attend. I hope you found it useful. Please stay in touch with us and have a wonderful rest of your evening. Thank you, everybody.